Greetings. My name is Dr. Pritish Singh. I work in Amrita Hospital as Senior Consultant and Professor in Pediatric Orthopedics and Deformity Cases. I chiefly deal with pediatric orthopedics and limb lengthening cases. So we get a lot of queries about height increasing surgery. So I will tell you about which cases require height increasing surgery, types of height increase in surgery, and which patients may benefit from this type of surgeries, and what is the approximate timeline required for, say, actual lengthening of the patient. And I will discuss in brief about surgical technique also. So when we speak about, say, types of height increasing surgery, so they can be either cosmetic height increasing or therapeutic height increasing. So cosmetic is someone, a healthy person who want to increase his height, is called as cosmetic height increase. Therapeutic is some patients, they are congenitally, they have short height, for example achondroplasia patients. So they are there is an option for them. They can also opt for increase in their height, and in stages we increase their height in such a way that they can appear or look like just like normal patients. So if we think of, say, which bone to increase, which bone height increase to be increased, so there are tibia and femur. There are two bones in the lower limb. So we can increase height of both the bones, tibia as well as femur, depending on requirement of patient. So if a patient wants, say, height increase of, say, only 2 inches or say 5 centimeter, so we lengthen only on one bone, both the tibia. So in tibia, this is I'm showing an example. So this is tibia. So in tibia, we can lengthen the tibia by around 6 to 7 centimeter, depending on, say, patient's requirement. In femur, we increase its height, the thigh bone. So thigh bone in height can be increased by 7 to 8 centimeter in one go. So if a patient who want height increase by, say, around 10 centimeter or more, up to, say, 12 centimeter or 14 centimeter, then we need to increase height of tibia as well as femur. And this can be done for one limb also, both the limbs also. There are certain subset of patients who require lengthening of only one limb. For example, they have some congenital anomaly or congenital deformity in one limb only, other limb is normal. So for that short limb syndrome, we also treat these patients on the same lines. So one thing requires particular mention. Say, first is time is essence. So these length increasing surgery or height increasing surgery, the time is important. So height increasing or length increasing, it is a slow process. We increase height of bone by at the rate of 1 millimeter per day, and this lengthening will require some time for bone consolidation or bone strengthening. So approximately 1 centimeter of length requires nearly 30 days of time for adequate strength to gain. So if a patient who want height increase, say, around 5 centimeter, then his approximate time is lengthening time is around 50 days or 60 days, but consolidation time is double of that period, so nearly 150 days, nearly 5 to 6 months. So it does not mean the patient need to be in the hospital for during the 5-6 months. Patient need to be near the hospital for the period when the lengthening is going on. So during the lengthening, a patient require very active supervision of treating doctor. So a patient has to be in the constant supervision of treating doctor for assessing progress of lengthening, any complication on, or, say, speed of lengthening. So time is essence. If some patients, they require lengthening of around, say, 10 centimeter. So increasing this amount of lengthening increases time period also. And if our time period is more, then we do lengthening in stages. So in stage 1, we lengthen, say, one tibia and other opposite femur. So that is called as cross lengthening. And in stage 2, we lengthen other bones, remaining 2 bones. So we divide the surgery in 2 parts, and during these parts, this will help the patient also, and this will help in physiotherapy and patient comfort and rehabilitation part. Yes. So if we speak about, say, surgical technique of lengthening, so the lengthening can be done by 2 methods, lengthening over nail and lengthening over fixator. And there is another method, that is fixator assisted lengthening. So lengthening over nail, we first, say, intramedullary nail inside the femur or tibia, whichever bone we want to lengthen, and we make a surgical cut, that is called as corticotomy, and that cut is gradually dissected in such a way that body lays new bone in that gap. So that is effectively called as limb lengthening or height increasing. So this nail is a special nail. It has some magnetic elements inside it, and it requires daily maneuvering. So this maneuvering is done from outside. It is not done from inside. And once we achieve the desired amount of lengthening, we lock the nails. We lock the nails means we put 2 screws at the one end of the nail and fix that, and the body strengthens that part of bone. So during this period, patient require extensive physiotherapy. Second method is lengthening over fixator or fixator assisted lengthening. So in this method, we again put a simple nail in the bone and we put an external fixator which is visible from outside, and with the help of fixator we lengthen that bone. So we again lengthen at the speed of 1 mm per day. So depending on amount of say lengthening, this lengthening period increases or decreases. So what is difference between pure lengthening over nail and pure lengthening fixator assisted lengthening? So lengthening over nail, pure lengthening over nail is done by precise nail. It is very costly to patients. They may not be economically sound to bear that cost. It is very costly. While the fixator assisted lengthening, it is quite cheaper and it gives very good and great results as just like that precise nail lengthening. Thank you. So for any query related to limb lengthening, bone lengthening or height increasing surgery, you may contact CureIndia. Thank you.
If you are interested in treatment in India, please subscribe to our channel and press the bell icon to never miss a new video from us.